Now coming to what? The spherical errors of the eye. Concave and convex both are the parts of spherical lens. Myopia and hypermetropia are usually called as the spherical errors. Why? Because we prescribe glasses which are spherical or cylindrical. So anyways guys, remember we are now starting with what? Now we are starting with astigmatism. Astigmatism. What is meant by astigmatism? If you recollect in your mind, astigmatism means what? Light rays focusing much before the retina leads to myopia. Light rays focusing on the retina is emetropia. Light rays focusing behind the retina is hypermetropia. But there are two different foci of light rays focusing, one on the retina, one somewhere else. It is called as what? Astigmatism. Most of the unhappy patients in the outpatient are usually suffering with what? Astigmatism. It is the most common refractive error to be seen, right? Almost all of us or some of us will have this problem called as astigmatism. Why? Because our cornea is a bit curved and a bit spherical at some sides. That's why you will see what, guys? Astigmatism. Astigmatism, right? So we are talking about what, guys? We are talking about the refractive error which is called as astigmatism. Astigmatism yani ke two or more than two foci could be seen which are being focused. That is called as astigmatism. This astigmatic cornea. This is astigmatic cornea, okay? Now, right. So regarding astigmatism, guys. Astigmatism is the most common refractive error. It is the most common refractive error. Most unhappy patients in the outpatient department, they are having what? They are suffering with astigmatism. Most unhappy patients in the outpatient department, they are suffering with what, guys? Astigmatism, right? Some of us or all of us will have astigmatism. Basically, some of us will have, some of us, right? We'll start from here. Most unhappy patients in the OPD is astigmatism, right? Why is astigmatism seen? Why is astigmatism seen? It is seen due to cornea being spherical and curved at some places. Cornea being spherical and curved at some places. One without astigmatism is having a perfectly spherical cornea. One without astigmatism has a perfectly spherical cornea. Perfectly spherical cornea. One without astigmatism is having a perfectly spherical cornea. Now, I have already told you guys what is astigmatism. Astigmatism, if you want to define again with the diagram, what we will define? Astigmatism is basically the light rays focusing. There are two different foci of light rays. One is focusing on the retina, one is either focusing either in front or either behind the retina. That is myopic or hypermetropic astigmatism. Okay. So there are two different foci of light rays. There are two different foci of light rays. In astigmatism, there are two different foci of light rays. Right? There are two different foci of, in astigmatism, there are two different foci of light rays. Now guys, remember, how will you treat this astigmatism? For treatment of this astigmatism, first of all, what is the complaint of astigmatism patient? Most common complaint of this patient is headache. Astigmatism patient complains of headache, right? So how will you treat this astigmatism? For treating this astigmatism, we require to give them cylindrical glasses or toric glasses. Cylindrical or toric glasses. The main complaint of the patient with astigmatism is headache or asthenopia. Maximum asthenopia is seen with astigmatism patient, right? When these patients read the chart, one side of the letter will appear blurred or hazy, the other is normal. Remember why? Because they are two. Whenever they are reading a letter or imagine there is a chart, guys. There is a letter given as A. When they see this chart, they will tell that one side of the A is appearing very clear to them. The other side of the A is appearing very blurred or hazy. Okay? Why? Because they are two different foci of light rays. Okay. So when these patients read the chart, one side of the letter will appear blurred or hazy. The other is normal. The other is normal. Then there are three types of astigmatism. Depending upon how much of correction is required, there are three types of astigmatism. One is called as regular astigmatism, other is called as oblique astigmatism, and a third one is called as irregular astigmatism. Regular, oblique and irregular astigmatism. Regular astigmatism means what? The cylindrical glass that is required to correct the regular astigmatism, it should lie in what degrees? It should lie in 90 degrees and 180. 90 to 180 degrees correction if it is required, then it is called as regular astigmatism. The cylindrical glass correction which is coming between 90 to 180, it is called as regular astigmatism. Oblique astigmatism means the cylindrical glass correction required in a degree of 30 to 60 or 120 to 150. In this range, 30 to 60 or 120 to 150 degrees, then it is called as what? Oblique astigmatism. Oblique astigmatism. Regular astigmatism is there, oblique astigmatism is there, and the last astigmatism is what, guys? Irregular. Irregular means what? We can't use the glasses to correct it. It requires only contact lenses, right? This is seen due to corneal opacities or any scar developing on the cornea. Okay? So basically what you need to remember, the regular and the oblique one. Irregular is basically, it's not treated by glasses, you require contact lenses. Okay? Regular astigmatism means what? The cylindrical lens required to correct the regular astigmatism, the degree lies between 90 to 180. Whereas oblique astigmatism means 30 to 60, the cylinder required is between 30 to 60 or 120 to 150. Then it is called as what, guys? It is called as oblique astigmatism. Oblique astigmatism. Okay. Apart from that, there are a few other types of astigmatism depending upon what? Just look over here, guys. Again, guys, this is the cornea. Second layer is choroid and here is the retina. Okay. So, guys, just look over here. Imagine one light ray is focusing before the retina and one light ray is focusing on the retina. Two different foci is called as astigmatism. If one light ray is focusing much before the retina and one is focusing on the retina, it is called as myopic astigmatism. It is called as what, guys? Myopic astigmatism. Which myopic astigmatism, guys? It is called as simple myopic astigmatism. Okay, guys. So we were talking about the other forms of astigmatism. The first one was simple myopic. Simple myopic astigmatism means what? One light ray is focusing on the retina, one is focusing much before the retina. It is called as simple myopic astigmatism. Simple myopic astigmatism. Then there is a thing called as simple hypermetropic astigmatism. Simple hypermetropic astigmatism. When it is called as simple hypermetropic astigmatism, just look over here, guys. Simple hypermetropic meaning what? Two foci of light rays. Yani one foci is focusing behind the retina, other foci is focusing on the retina. This is called as simple hypermetropic astigmatism. This is called as simple hypermetropic astigmatism. Then there is called as compound hypermetropic. Compound hypermetropic or compound myopic. First of all, compound myopic is what? Just look over here, guys. Two different foci of light focusing before the retina. Both the light rays are focusing before the retina, compound myopic. Both the light rays focusing behind the retina, compound hypermetropic. Then there is a mixed astigmatism. When do you call it as a mixed astigmatism? Look over here, guys. So, mixed astigmatism means what? One light ray is focusing behind the retina and one light ray is focusing before the retina. One light ray is focusing behind the retina and one light ray is focusing before the retina. Yani ki myopia and hypermetropia both are seen. That is called as mixed astigmatism. So, these are the glasses which are required for astigmatism management. Okay. But depending upon the glasses also, we can say whether it is simple myopic, oblique astigmatism or regular or irregular astigmatism. Okay. So anyways, guys, remember simple myopic is there, simple hypermetropic. Simple myopic means what? One is focusing on the retina, one is focusing before the retina. Simple hypermetropic means what? One is focusing on the retina, one is focusing behind the retina. Compound myopic means both are focusing before the retina. Compound hypermetropic means both are focusing behind the retina. Mixed means one is focusing in front of retina, other is focusing behind the retina. So these are what, guys? These are the different types of astigmatism. Okay. So guys, remember, if you compare myopia, hypermetropia and astigmatism, myopia, where is the light ray focusing? Before the retina. Hypermetropia, behind the retina. Astigmatism, two different foci are there. Okay, two different foci. Okay. Next, which is the most common? Astigmatism. Second most common, myopia. Third, hypermetropia, which are called as far-sighted myopia, short-sighted, far-sighted, wrong. Far-sighted are, which are called as far-sighted, yani ki far things can be seen properly, hypermetropia. Short-sighted, myopia, which requires who go into cave? Myopics go into cave, concave. Whereas hypermetropics, convex lenses. Okay. For astigmatism, what is the lens that we gave? The toric or the cylindrical lenses. That was regarding the myopia, hypermetropia and astigmatism. Coming to the last refractive error, that is called as presbyopia. Last refractive error, which is called as what, guys? Presbyopia. What is meant by the term presbyopia? Come on, guys. What is meant by the term presbyopia? Presbyopia meaning what? Remember, guys, all of us who are listening to this class, all of us will develop presbyopia at a certain age. At a certain age. Okay? At a certain age, we will develop presbyopia. Why? Because what happens? The ciliary zonules and the ciliary muscles becomes weak. The lens capsule becomes hard. Due to that, what will happen? Accommodation is gone. The near vision will be a problem. Normally, at the age of 45, if the patient comes to you saying that, doctor, I am not able to read the newspaper clearly, that means he has become hypermetropia. Basically, hypermetropia developing at the age of 45 is called as presbyopia. Age-related hypermetropia is called as what? Presbyopia. Why do you see presbyopia? Why? Because this patient's ciliary muscles have become weak. The lens capsule have become hard, right? And this patient develops presbyopia at the age of 45. How about the myopics who are sitting and listening to my lecture? I am also a myopic. When will I develop presbyopia? At the age of 45 only, sir. Or sometime 50. We'll have a delayed occurrence of presbyopia. How about hypermetropics? Hypermetropics will also develop presbyopia. Yani already he is having problem in the near vision and he is using glasses. Okay. But as he becomes 45, his near vision problem will further increase. Why? Because age-related hypermetropia is called as presbyopia. But hypermetropics can have an early occurrence of presbyopia if you have undercorrected the hypermetropics. If you have undercorrected the hypermetropics, they will have early occurrence of presbyopia. So once again guys, what is presbyopia? Age-related hypermetropia. After the age of 45, no one will be spared. Everyone will become presbyopic. Okay. So just write there guys, presbyopia means age-related hypermetropia. Presbyopia is age-related hypermetropia. Age-related hypermetropia is called as what guys? Presbyopia. So age-related hypermetropia is called as presbyopia. Why there is what is the cause of presbyopia guys? What is the cause of presbyopia? As we are aging, what is happening to the ciliary muscles? The ciliary muscles become weak. The ciliary muscles become weak. The zonules become weak. And the lens becomes more fibrotic. Lens becomes more fibrotic. Hence, what is being lost? Accommodation is lost and all. Okay. So, as we are aging, these things will happen. Ciliary muscles will become weak, the zonules become weak, the lens becomes more fibrotic, and we develop what? Presbyopia. Presbyopia. Right? Remember guys, presbyopia, they'll have problem with the near vision. After age of 45 years, patient complains of problem in performing any near activity, in reading any near, problem in reading, right? Remember, all of us will develop presbyopia. All of us will develop presbyopia. The ones who are myopes, when will they develop presbyopia? They will have a delayed occurrence. Delayed occurrence. Ones who are hypermetropes, they will develop presbyopia at 45 years. But some hypermetropes will have early occurrence of presbyopia. Will have early occurrence of presbyopia. Why? Why some hypermetropes will have early occurrence of presbyopia? If they are undercorrected. If they are undercorrected, they'll have the problem of, they will have an early occurrence of presbyopia. Okay. For presbyopia, what we give guys? For presbyopia, management is giving them what glasses? Convex glasses. For presbyopia, management is what guys? Prescribing the patient with convex glasses. Why convex glasses? Why cannot you give concave? No need of concave, sir. Concave is used for myopia. Presbyopia is age-related hypermetropia. Age-related hypermetropia. Is this thing clear, guys? This is regarding what? Presbyopia. Now, guys, imagine I am a myopic. At the age of 45 or 50, I will develop presbyopia. I am not able to read the near things properly. I am wearing concave glass. After the age of 45, with concave, I have to wear a convex also. So, should I wear concave for the far things and convex other glasses? Should I carry two glasses? No. I will use a bifocal lens. You might have seen in your parents' glasses. There will be a flat part and there will be a curved part. That is called as bifocal lens. Bifocal lens. So treatment is by convex glasses, or you can give bifocal lens. Bifocal lenses. Now guys, imagine a patient is there who's at the age of 45 complaining that, doctor, I am not able to read the near things. He is not able to read near things. Is it normal or abnormal? It is totally normal. You have to explain the patient that after the age of 45, you have become presbyopic. Age-related hypermetropia is presbyopia. You have explained it to the patient. Okay. Now, you have given him what glasses? Convex glasses. Magnifying convex glasses you gave. Now, after 1 month, the patient comes to you with a sweet box saying that, doctor, your glasses did some miracle. Now, without glasses also, I am able to read the near things properly. What will you do? First, accept the sweet box. Okay? And explain him that this is not at all normal, sir. Why this is not normal? Once presbyopic, always presbyopic. But why did he develop this vision, good vision, normal vision? Why? Because if he develops, remember, if any patient after the age of 45 comes to you and tell that, doctor, without the convex glasses also I am able to read the things properly, that means there is an alarming sign. What alarming sign? This patient might have developed what cataract? Nuclear cataract. So imagine, guys, just look over here. Just imagine, look over here. A patient is there. Who comes to you. Okay? We are describing this patient. Okay? This is the cornea. Okay? He comes to you after the age of 45 complaining that he is not able to read the far things properly. Okay? This is the retina. This is the retina. So just look over here. Basically, his light rays were focusing much behind the retina. So you gave him convex glasses and his light rays are focusing on the retina. But after some time, he is coming to your hospital and is saying what, guys? He is saying that, Dr. Saab, please accept my sweet box. Why? Because I am able to see what? I am able to read the near things properly without what? Without any glasses. Is it normal? It's not normal. Why? Why? Because this patient had developed nuclear cataract. If the patient developed nuclear cataract, if this patient develops nuclear cataract, what will happen? What will happen, guys? Nuclear cataract. Due to nuclear cataract, what happens to the refractive index? The refractive index increases from 1.40 to 1.42. As the refractive index is increasing, what will happen? It will pull the light rays. So now, where are the light rays focusing? They are focusing on the retina. So, yani ke basically, this phenomena is called as second sight phenomena. Second sight phenomena meaning what? A presbyopic patient developing a normal vision. Is it normal, guys? No. Once presbyopic, always presbyopic. If any presbyopic patient develops a normal vision, that means what? He might be having nuclear cataract. Due to that, his light rays are focusing on the retina. His light rays are focusing on the retina. This is called as second sight phenomena. You have to accept the sweet box and tell him the bitter truth that you are having nuclear cataract. Please remove you have to undergo the surgery, and after surgery again you will be presbyopic. Okay? Okay, guys. So this was regarding what? This was regarding the refractive errors. Thank you.